Mental illness and addiction are both diagnoses under the DSM, the Diagnostic
Statistical
Manual. Thank you. And I can remember that one. So, an addiction is actually a mental illness. It's related to the brain, where the brain is altered and behaviors are altered. They're in pain. What do you do when you're in pain? You seek to remedy that pain. You don't want to be in pain anymore. So they take substances. They go, wow, I don't feel that pain anymore. So I got to keep using that substance to keep numbing that pain because I felt awful before. Why would I want to feel awful again? So I'm going to keep doing what I found as my skill, my technique for feeling normal or better, just like everybody else around me.
This happens to anybody and everybody. Like it's not based on socioeconomic, where you come from, who you are. It's just, this is a disease that can hit anybody.
What keeps us from having that conversation is the stigma and the shame. I mean, do you really want to talk about how grandma every Sunday dinner was under the table and had to be escorted, picked up and put into bed after, maybe that happened in some people's households.
So the important message is for families is to really educate yourself on what they're going through and do sort of the family history. Is there family history of addictions in the family? Is there a family history of mental health that you might be aware of?
There was just a release of data just today on the numbers of children seeking hospital or being hospitalized for mental illness and substance use disorder have gone up 200%.
Wow.
For disorder and 100% for suicide admissions for children across Canada. Parental health is huge. That's why we created FAR. Our children's needs aren't met. Maybe parents have an influence on, making themselves better. You talk about the rabbit hole. They're down in the rabbit hole. Do you really want to keep joining them down in the rabbit hole?
Right.
No, because you also you're a parent to other children, you're a spouse, you've got a job or whatever, right? So you really have to take care of yourself.
So she was under 16 and she could refuse treatment.
Yeah.
Wow.
Talking to as many families as I do, I think this capacity issue is huge for so many of them. Because what happens is the providers assume capacity. Even before they're talking to these kids, they assume that the kids have capacity. What's wrong with that is they have a brain disease. And if they have both addictions and mental health, right from the get-go, they don't have capacity. To make matters worse, because of stigma and because primarily of privacy laws, they look at families and go, sorry, we can't talk to you. It's against privacy laws.
If I am hearing you right, and from what I have gleaned over the years, is that they can tell you 5 minutes before, I wanted to harm myself. But if they go into that hospital and say no, they can get released. That's what you're saying to me, Sydney?
Yeah,
and
absolutely.
Angie just put up here that, addiction doesn't discriminate, but recovery does. That's so good, Angie. Those with dollars can jump the wait list.
A victory moment for me is part of our mission statement. That's compassionate, evidence-based, timely treatment options.
And now we sort of reached a point where we are looking at, we only have so many resources. We've only got so many vents in the hospital. We've got too many patients coming in. Who gets that vent? Those are life and death decisions.
Wow.
And brutal. And can you even imagine having to make those decisions? Well, we can, because it happens every day in the mental health world. It's really important to educate the public so that they have a really good foundation on what mental health and addictions is. So when we get into these conversations about decriminalizing, that they understand that's part of the treatment plan for people.
We need to stop this judgment that we do to people, that we do to no one else when they have a mental health problem. If we do not stop this, if you think this pandemic called COVID was a problem, what we're about to experience in the next few years, if we do not get our act together in Canada, is going to be far more detrimental. Thanks, Angie. No more judgment, no more discrimination. The system causes as much trauma, and having a loved one with this life threatening illness